Skin cancers are common. Among them, squamous cell carcinoma and basal cell carcinoma are two of the most common skin cancers. But sometimes we get easily confused with these two skin cancers. So, let's try to learn the key differentiating point between squamous cell carcinoma and basal cell carcinoma. Let's begin. Squamous cell carcinoma arises from squamous keratinocytes in the spinosum and granular layers above the basal layer of epidermis. And basal cell carcinoma originates from the basal cells of the epidermis, the deepest layer of the skin. Both are linked to UV exposure, fair skin, and aging. SCC is often associated with chronic wounds, scars, non-healing sores can sometimes undergo malignant transformation, and human papillomavirus infection. Meanwhile, BCC is linked to genetic syndromes and arsenic poisoning. Squamous cell carcinoma grows faster, often within weeks to months, while basal cell carcinoma is very slow growing, over months to years. SCC favors sun-exposed areas like lips, ears, scalp, and hands, whereas BCC is more common on the central face, nose, and eyelids. In squamous cell carcinoma, the lesion is firm, scaly, and often crusted or keratotic, with early ulceration. Basal cell carcinoma, by contrast, is a pearly nodule with rolled edges and surface telangiectasia. With progression, it develops a central ulcer known as a rodent ulcer. Squamous cell carcinoma can cause pain or tenderness and has a significant risk of metastasis. Basal cell carcinoma, on the other hand, is usually painless but bleeds easily on minor trauma. It is locally destructive but almost never metastasizes. Diagnosis for both is clinical, sometimes aided by dermoscopy, but always confirmed by biopsy. Histopathology remains the gold standard for differentiating squamous cell carcinoma from basal cell carcinoma. In doubtful cases, immunohistochemistry can provide additional confirmation and guide management. To recap, squamous cell carcinoma grows faster, looks scaly or crusted, may cause pain, and can metastasize, especially from high-risk sites or scars. Basal cell carcinoma, on the other hand, is more common, grows very slowly, forms a pearly rolled-edge nodule, and while locally destructive, almost never spreads. And that's the key comparison between squamous cell carcinoma and basal cell carcinoma. If you found this video helpful, please like, subscribe, and share with fellow learners. See you in the next video.